system is broken, it is dysfunctional, and it is cruel. Today we have 85 million Americans in the wealthiest country on earth who are uninsured or underinsured. 1 out of 4 Americans cannot afford to fill the prescriptions that their doctors prescribe. Our life expectancy is significantly lower than other wealthy nations. Some 60,000 Americans die each year because they can't afford to get to a doctor on time. And in fact, we don't have enough doctors, nurses, dentists, and other healthcare professionals. Meanwhile, because of the greed of the insurance companies and the drug companies, we are spending far, far more per person on healthcare than the people of any other country. We are now over $14,000 for every man, woman, and child, which is an insane number and totally unsustainable. So what we have is a crisis in healthcare, and Trump's big, horrific bill will make that crisis much worse. It will throw 15 million Americans off of the health care they presently have. So instead of providing health care to all people, throwing 15 million people off of health care, it will raise insurance premiums for millions of people all over the country, already paying sky-high prices. It could well cause the closure of many rural hospitals and community health centers all across our country, all of whom are significantly dependent on Medicaid funding. It will also, and the point of our discussion today, it will also have a major impact on nursing homes in this country. And that is an issue that has not gotten the kind of attention that it needs, and that's why we are holding this event today. According to a study commissioned by the Department of Health and Human Services, 70% of seniors in an aging country, we are an aging country, will need some kind of long-term care during their lifetimes. This can include assistance with activities of daily life like eating, bathing, and dressing. In some cases, family members can provide this type of care, but it requires from that family member enormous time, effort, and skill. And when you are dealing with horrific illnesses like dementia or Alzheimer's, it is also terrible stress on that family member. And that is why families throughout the country seek our support through home health care providers, through senior centers, or nursing homes. And let's be clear, even before the implementation of Trump's horrendous bill, nursing homes and long-term health care providers were already struggling. All right, so it's not like we had a great situation. We have a very bad situation, which is only going to be made worse. When you cut Medicaid by over $900 billion, as this bill does, nursing homes and long-term health care providers will be losing a major source of their revenue. In other words, you have institutions all across this country that are struggling today, and now there's going to be a significant decline in their revenue. We're going to be talking in a moment from our guests about what those cuts will mean. According to a recent survey, as a result of this legislation, some 27% of nursing homes have indicated that they will be forced to close their doors, and 58% will be forced to substantially reduce staff at a time when many nursing homes are already grossly understaffed and under-resourced. When it comes to home and community-based care, the problem may be even worse because states aren't legally required to cover these services under Medicaid. States could cut benefits for long-term home care altogether. And what does that mean for families across the country? It means that people who need long-term care will probably rely on a family member to care for them. And what that will do is put enormous stress on family members. So right now, I want people to appreciate this. If you have a mom or a dad or somebody in your family who is in a nursing home or a home daycare center, if that person can no longer be in that facility and has to be at home, how does it impact you? Well, guess what? You're not going to work anymore. You're going to stay home taking care of that family member. And if you don't go to work anymore, you're not having any income coming into your house. And how does that impact people in our country, 60% of whom are living paycheck to paycheck? So this bill is a disaster in general. It will be a disaster for nursing homes. And I want to introduce now people who know more about it than I do. And let's begin with Katie Smith-Sloan, the CEO of Leading Age. Katie, thanks so much for being with us.
Thank you, Senator. Thanks so much. So I want to start by acknowledging the significance of today, the 60th anniversary of the Medicare and Medicaid programs. So over these 60 years, both programs have supported the services, supports, and care of literally millions of older persons. They are a lifeline. Medicaid is the primary payer of long-term services and supports. There is simply no other for the services provided in a range of care settings, including nursing homes. So now let's talk about need. At present, older adults over age 65 represent nearly 20% of our population, and that percentage is steadily increasing. And as it does, the demand for services and care will grow. At Leading Age, our nonprofit and mission-driven, community-based member organizations are committed every day, as they have been for decades, to meet that demand, whether it be for care in a nursing home, or adult day centers. Depend on Medicaid payments to deliver payments that even before the are